Greetings, and welcome to the Hanoi School of Public Health. It is my pleasure to make a presentation to you about our school. This presentation will give you insight on the way forward of Hanoi School of Public Health in making a difference. This is a story in 3 parts. First, the new needs in healthcare in Vietnam. Second, the Hanoi School of Public Health and its will to grow. And third, the Hanoi School of Public Health and its good works made so far. There are 3 important components in the process of shaping a new professional training structure. In Vietnam, public health is a new perception. Health of all, for all, and by all. This requires that we understand the risks are biological, social, and behavioral. And it also requires linking of health information, promotion, and advocacy. Therefore, we incorporate new approaches with the main objective of moving from not having diseases to having a long and quality life. A strategy moving from prevention of known causes to reducing risk factors. And research-based policy. And this comes with the establishment of new organizations and a new contingent of healthcare workers. From biomedicine to multidisciplinary, community-based public health professionals, public health scholars, and advocates. These components are logically interrelated and have ongoing evolution and interaction corresponding to practical changes and demands. The new professional training structure that I have just mentioned is the Hanoi School of Public Health. It was established on April 26, 2001, and is the first standalone public health training institution in Vietnam. Our introduction of the school will cover 3 main issues and topics. First, the school's development strategy. Second, how is the school organized to complete its mission? And third, who are we at the Hanoi School of Public Health? Hopefully, after giving answers to those questions, you will have more understanding of our school. The Hanoi School of Public Health needs to have a planned and prioritized way to ensure a viability of the school and adequacy of the teaching, research, and service components of its work. This is a quote from an international evaluation team in late 2000. At that time, our school was young and had not been officially upgraded as an independent university. This evaluation reflects clearly our status at that time. It is our position that we need to go through 2 phases in our development process. The first phase is from infancy to viability, in other words, from inadequacy to adequacy, and the second phase, from viability to expansion, that is to say, from adequacy to excellence. These 2 phases require core competence as the first priority. In any public health school, there are 3 groups of competencies that are needed. These are, first, training, second, research, and third, consultancy and advocacy. This slide illustrates more about how we can achieve the development goal of the Hanoi School of Public Health through phases presented earlier. Our mission. At this moment, this is how we envision ourselves making a difference in Vietnam's healthcare and society at large. To be a leader in public health training, research, and consultancy in Vietnam and the region. This chart illustrates the organizational structure of the Hanoi School of Public Health. Such a structure will help us to reach our objective during the first phase of development. Attention should be given to our program that we highlight much on the training component and the field study. In order to accomplish this, we have set up academic departments to cover all 5 core disciplines of any public health school in the world. However, they have been taken into consideration during the process of developing our training program to best serve the practical protection and promotion for Vietnamese people's health. We are fully aware that a public health training institution cannot function in the absence of partnership. We have therefore built collaborative and cooperative relationships with the Ministry of Health, the Ministry of Education and Training, other government agencies, other Vietnamese universities and colleges, the National Public Health Network, foreign universities and colleges, the International Public Health Network, media and the general public, and our donors. So, who are we at the Hanoi School of Public Health? We are made up of students, faculty, and support staff. First, we should talk about public health postgraduate students because they enroll in a traditional training that is made available in all public health schools. Masters in Hospital Management courses have been run by the Hanoi School of Public Health to meet the urgent need of the health service delivery system in Vietnam now. Currently, we have an annual intake of 50 to 60 Masters of Public Health students since 1997, and an annual intake of 20 to 30 Masters of Health Management students since 2008. The Bachelors of Public Health training program is a new program to meet new objectives in response to changes in disease patterns. This type of training includes full-time and in-service students, and was started in 2002. We are currently admitting 350 students annually. The PhD training component has the aim of moving forward to the in-depth research capability and skills of enrolled students. Currently, we enroll 5 PhD students annually. Professional training will meet immediate needs and provides a basic solution to emerging problems in Vietnam. On the other hand, this training creates a platform for the learner to gain qualifications in the long term through our credit-based training program. Currently, we train more than 1,000 students per year, enrolled from multiple disciplines. The contingent of support staff forms the backup for the school's training, research, and consultancy activities. Those staff members are now more professionally developing. They include 55 employees and 8 functioning departments. We have 97 full-time and 22 part-time faculty in 16 academic departments. They have played a decisive role in the advancement of our school. The past years have seen a rapid growth of this contingent in response to our rapid development. This graph illustrates the rapid growth of Hanoi School of Public Health staff. To better describe the quality of our school's development in such a modest period of time, we would like to introduce some preliminary achievements in the following aspects: education and training, research and policy advocacy, cooperation for resource sharing, and infrastructure development. This graph illustrates the increasing numbers of public health postgraduate students since the opening of our school. And this map illustrates the expansion in geographical coverage in terms of the school's enrolled students from 1997 to 2011. We systematically address major national health problems. The first example of this is injury prevention. Beginning with the establishment of the Center for Injury Policy and Prevention, we have conducted multi-center injury studies leading to the 2002 to 2010 National Injury Prevention Policy. Tobacco control research is another good example of our proactive approach toward the objective of people's health protection and promotion from scientific research to policy and advocacy. To promote continued successful translation from research to policy and advocacy, we have established and closely collaborate with the Vietnam Public Health Association at central and local chapters. The quarterly journal of the Vietnam Public Health Association is circulated widely among academia and practice facilities, and is a cornerstone of communication in public health research and policy issues. The Hanoi School of Public Health became the first smoke-free university in 2008 and is recognized by the World Health Organization with an award for tobacco control activities. Another example of our research and policy advocacy is our dioxin harm minimization program, which has had an observable impact on the knowledge needed to prevent exposure to dioxin in two hotspots, Bien Hoa and Da Nang. Following our goal to utilize different resources for developing public health in the country, we have established cooperation with the United States CDC under PEPFAR for public health in general and for HIV/AIDS prevention in particular. This is the signing ceremony initiating our cooperation. And this is a photo of a working visit of the U.S. Health and Human Services Secretary and the U.S. Surgeon General. The Hanoi School of Public Health has become an official member of different public health associations worldwide, including the Asia-Pacific Consortium for Public Health, the International Network for the Demographic Evaluation of Populations and Their Health in Developing Countries, the International Network of Institutions for Higher Education in International Health, and the Association of Pacific Rim Universities. Professor Michael Dunn from the Queensland University of Technology has the following to say about collaboration in public health training and development with the Hanoi School of Public Health.
The quality of the work that you're doing is really very good. I think that our project, which went for 5 years, was really effective in, well, we did quite a lot of work on curriculum, but then we started to do some research as well. And as part of that, we were involved in the training of 6 of the lecturers for Masters and PhD. Now, in about 2005, we started to work with a network of other faculties. And so QUT and Hanoi School of Public Health became the consultants in that national project with Cần Thơ, Ho Chi Minh City and Hue. And really the Hanoi School of Public Health has made a significant contribution in terms of giving advice for the curriculum, for providing access to a lot of textbooks and material, but also to promote the use of active teaching methods, which really was first developed in this school and then has now been warmly received by the students in the other faculties.
To promote an adequately strong infrastructure, meeting the needs of long-term and sustainable development, we have finalized plans to build a new campus on land in Hanoi, Capital Region, which is many times larger than the current campus. Supported by investment capital from the government and international organizations, the new campus will be completed in 3 or 4 years' time, providing us the expansive resources to solidify our position domestically and internationally. Our Minister of Health, Associate Professor Dr. Nguyễn Thị Kim Tien.
Đối với trường này thì về chuyên môn để hỗ trợ trường các cái đề nghị mở mã ngành hoặc quy mô đào tạo hoặc là mở sau đại học thì Bộ Y tế đều ủng hộ, cũng như là các cái hỗ trợ về tạo điều kiện để trường mở rộng các cái hợp tác trong và ngoài nước, liên kết với các đơn vị đào tạo khác. Cái thứ ba là trường cũng được Bộ Y tế cho cái chủ trương và hỗ trợ để mà thực hiện cái đầu tư dạng BT, tức là xây dựng chuyển giao, tức là nhà trường thì đã được thành phố cấp cái đất ở Đông Ngạc Từ Liêm để xây dựng cái cơ sở mới, vì cơ sở này nó lâu và nó nhỏ.
The government has allocated additional land for the Hanoi School of Public Health to build its new campus to accommodate the accelerated programming growth in both training and research. With a modern campus and other resources, we believe we will accomplish our mission to be a leader in public health training, research, and consultancy in Vietnam and the region. Until 2005, there was no recognized occupation in public health in Vietnam. But now public health professionals are recognized as healthcare service providers with an official pay scale in the Ministry of Health. That, we believe, is a very important change. Our nascent Hanoi School of Public Health has proved itself to be a stronger institution. Its will to grow has been recognized through its good works. This is our commitment, and therefore we look forward to your cooperation, collaboration, and assistance. So, this is our story in 3 parts. New needs in healthcare in Vietnam, the Hanoi School of Public Health and its will to grow, and our good works made so far. Thank you for your attention.